School staff have both a legal and ethical responsibility to recognize and respond to suicidal thoughts and actions they witness in students. Although many children and teenagers experiencing suicidal thoughts or behaviors do not self-refer, most will show some signs of warning. Never ignore these signs. Suicide prevention should be an integral part of your school's mental health and safety supports. Your school's crisis response team is responsible for developing and implementing suicide risk assessment, intervention, and follow-up policies and procedures. Be aware that sometimes these protocols are created at the district level by a crisis response team. At least one staff member will be assigned the role of designated reporter, who will receive and act upon all reports from staff or students about students who may be suicidal. The staff member assigned to this role should ideally be a mental health professional, such as the school nurse, social worker, counselor, or psychologist. All staff should receive training annually on the warning signs and referral process for students who display signs of suicidal behavior. Students should also receive instruction about risk factors, warning signs, and resources they have available to get help for themselves or a friend. The foundation for effective suicide prevention rests on both providing a safe, positive, and welcoming school climate and ensuring that students have trusting relationships with adults. Schools should have supports that implement a comprehensive suicide prevention program, such as Signs of Suicide, SOS, as well as a publicized tip line for students to call or text with concerns. Bullying and suicide-related behaviors have a number of shared risk factors, including mental health challenges. These challenges could include depression, hopelessness, and substance use or abuse. Youth who report frequently bullying others and those who report being frequently bullied are at increased risk for suicidal thoughts and behaviors. Bully victims are at the highest risk for suicidal behaviors. Keep in mind that while bullying may be a precipitating event, there are often many other contributing factors, including underlying mental illness. Prevention should also address non-suicidal self-injury, NSSI, or cutting. While this behavior is not typically associated with suicidal thinking, it is a red flag that someone is distressed and does increase the risk for suicidal actions. It is important to educate staff on the signs of NSSI, including cuts, burns, scratches, scabs, and scrapes, especially if they are recurrent and if explanations for the injuries are not credible. A suicide risk assessment should always be a part of intervention with a student who displays NSSI. When school staff becomes aware of a student exhibiting potential suicidal behavior, they should immediately escort the child to a member of the school's crisis team for a suicide risk assessment. They should not send the student on their own. If appropriate staff is not available, 911 should be called. Usually, it is best to inform the student of what you are doing every step of the way. Ask for the student's assistance where appropriate. Under no circumstances should they be allowed to leave school or be alone, even in the restroom. Supervise the student until a 24/7 caregiving resource can assume responsibility. Members of the school's crisis team should conduct a suicide risk assessment. The purpose of the assessment is to determine the level of risk and to identify the most appropriate actions to ensure both the immediate and long-term safety of the student. Caregiver notification is a vital part of suicide prevention. The appropriate caregiver must always be contacted when signs of suicidal thinking and behavior are observed. Helping the student develop a safety plan can be immensely helpful. For example, give students a written list of coping strategies and sources of support that can be of assistance when they are having thoughts of suicide. Suicide prevention hotlines can also be great elements of a safety plan. Schools are legally obligated to document every step in the assessment and intervention process. This helps ensure that protocols were followed correctly. Every district should develop a form for support personnel and crisis response team members to record their suicide intervention action and caregiver communication. Staff members that are responsible for the safety and welfare of the student should be provided with the necessary information to work with the student and preserve their safety. Following a suicide, school communities must strike a balance between allowing students the opportunity to grieve but while not glorifying, romanticizing, or sensationalizing suicide, all of which increase suicide risk for other students. Contagion is what occurs when suicidal behavior is imitated. This is strongest among adolescents, largely because they may identify more readily with the behavior and qualities of their peers. Guilt, identification, and modeling are each thought to have a hand in contagion. Studies indicate that 1 to 5% of all suicides within this age range are due to contagion. If contagion is identified, school administrators should take steps beyond the basic crisis response, including vamping up efforts to identify other students who may be at heightened risk of suicide, collaborate with community partners in a coordinated suicide prevention effort, and potentially bring in outside experts. It is important that staff not underestimate the potential impact that a suicide can have on both students and staff members. The school and its staff should promote a culture in which students and adults in the building feel comfortable asking for help and taking a break. Suicide is an exceptionally difficult topic for all parties involved, but with proper protocols in place for prevention, identification, and intervention, schools and their staff can provide the resources to support any student that may be suffering.